Yeah, we had a question from one of the patients that asked, "Why, doctor, am I so tired?" Now that's a very, long type of question or answer that I can give. There's so many things that can cause chronic fatigue or fatigue. One of the main ones is sleep. Any kind of like insomnia or not sleeping well. That's one of the things that we like to do is a sleep study. We're set up to go ahead and check to make sure that you're getting at least 2 or 3 cycles of REM sleep, deep sleep, and you're not getting interrupted sleep due to obstructive type symptoms, where you're not breathing at night and, people don't realize that they're getting full, sleep. So sleep study is very good. Everybody needs to get a really good, consistent, about 6 hours of sleep. A lot of times what I'll ask my patients is, in the morning when you wake up, do you feel rested? And some people could tell me, even if I slept 8 hours, I still wake up and I'm not rested. I feel like I could keep going. That usually is a good indication that somebody may have sleep apnea and they're not getting deep sleep and they're getting obstructive type symptoms at night. And most of the time the partner's the one that tells me, yeah, I hear gasping for air sometimes or snoring. So those are usually pretty big indications. And those things also put you at risk for cardiac arrhythmias like atrial fibrillation. So anytime I see atrial fibrillation, I always look for a sleep study. Or you also have issues with hypertension, blood pressure issues, where people have a hard time losing weight or controlling their blood pressure, has a lot to do with sleep apnea. So sleep is one of the most important things. I say about 50% of the time. Unfortunately, people, their body's tired, but their brain is wired. They can't shut off their brain, and they have either difficulties getting to sleep or staying asleep. And then that's when we also look at possibility of neurotransmitter deficiencies, things like serotonin, dopamine. These are chemical messengers in the brain that turn off the brain and help it, relax. So there's ways that we can optimize those neurotransmitters and help with insomnia, depression, anxiety, and better sleep. The other thing that could be happening is elevated cortisol, which is a stress hormone. And unfortunately, a lot of people don't de-stress before going to sleep, and their cortisol levels could be high at night, and that's also affecting their ability to fall asleep. So we check for cortisol issues, especially at nighttime. That's when it should be low. And it should be high in the morning. That's what gives you a kick in the butt to get going. So that's another indication sometimes when people wake up in the morning and don't have that ability to get, going, and they have to drink a couple cups of coffee before they get going. That's another indication that their maybe adrenals, due to stress, are taxed and they're causing low cortisol. So that's another reason we check cortisol. So now we're dealing somewhat with hormones causing issues with fatigue. The other things that could be causing fatigue are nutrient deficiencies. Unfortunately, most people are not absorbing most of their nutrients due to taking acid blockers, or digestive type medications for their stomach, which blocks their acid production. And without acid production, you can't absorb B vitamins or iron or certain other nutrients like magnesium, and you get deficient. And over time, those vitamins and minerals are crucial in helping a lot of enzymes that help with metabolism and fat burning. Nutrients is a huge part of it. The other thing that can be causing a lot of fatigue is leaky gut due to food sensitivities. These are foods that you need to eliminate from your body that you may not know that you're allergic to them. It's actually not allergy, it's sensitivities, where your body is having leaky gut or inflammation and causing inflammation.